So let's talk about a clinical case of achalasia. Now, achalasia is simply going to be a loss of peristalsis in the lower or the distal esophagus. Now, also what you'll see is a lower esophageal sphincter tone increase because the muscle is going to be contracted. So we're at the very bottom of the esophagus, our sphincter tone is going to be very rigid because we're going to increase our sphincter tone, meaning when we take a swallow, food, liquids not going to be able to pass through that sphincter. So clinically, what are we going to see? Well, I just said that. Food plus water, dysphagia. So dysphagia, we're not able to swallow easily properly, and it's going to relate to both food and water. The water is going to what's really trigger you off to the achalasia because there are a lot of instances, a lot of causes for food dysphagia. However, once you start getting water dysphagia, then you need to start thinking, is that sphincter correct? So that's one of the clinical features that you're going to see. Also, you'll see some swallowing difficulty. You'll see some vomiting. Vomiting as well because the food is not able to go down into the stomach. So hence that. You'll also see some belching. If you see a patient, the number one thing is going to be the water dysphagia, but you may also see some weight loss, some vomiting, difficulty swallowing, etc. So how are we going to diagnose this? Well, barium study. You're going to do a barium study on the esophagus. So we're going to swallow the contrast dye and look at it, and there's one buzzword that will always show up on board exams, clinical questions. That's going to be the bird's beak. So you're going to see a bird's beak on esophageal barium study. So what does the bird's beak mean? Well, it simply means that here's our esophagus, here's a normal esophagus. Then you go into the stomach, etc. However, for this, we're going to kind of taper down, and then here's our stomach. And we're going to get this bird's beak appearance because here you go, here's your little bird, he's looking down, dive bombing the stomach. This is going to be your bird's beak appearance. So our bird's beak on the esophageal barium study, this is going to be hallmark of achalasia. What's going on is here's your sphincter, the muscles are really tight, so we're closing the area from the esophagus to the stomach, so the GE junction is going to be closed, allowing food and water to not pass. However, here our sphincter is going to be loose. Here's the muscle that I'm drawing in. The muscle is going to be loose, allowing passage. Now, what are some of the complications? The number one complication is going to be increased risk of cancer. So esophageal cancer is going to be your number one complication of achalasia. So you need to monitor it through endoscopies on a regular basis with your physician. Treatment. Now, there's quite a few different ways that you can treat achalasia. Some are more commonplace than others. Number one, at least through my experience, is going to be dilation. So pneumatic balloon dilation. So what they're going to do is they're going to stick a probe down through the esophagus, inflate a little balloon, and stretch out the sphincter muscle. Now, it can increase your chances of GERD, gastric reflux. However, that risk is a little more minimal, and plus, not being able to pass food and water is going to be a much more high priority issue than gastric reflux. Now, what also you can do is there are medications out there. There's calcium channel blockers, there's nitrates. Those can also be used. Not as high yield. The medications don't work as well. This mechanical dilation is going to be the number one option. Also, you can cut the sphincter, so go in, take part of the muscle and cut it, and that's going to be a surgical myotomy. Plus, you can wrap it. So that's going to be another option. So surgical myotomy, and then lastly, there's treatment through the botulism toxin. So just like the botulism toxin used in plastic surgery, where you have a face that kind of gets paralysis, you get the wrinkles out. Same principle. You go in and inject some botulism into the sphincter. The muscle relaxes a little bit, but you got to do that every 6 months or so to keep the relaxation, because once the botulism toxin wears out, it's all over. So this is kind of the rundown on achalasia, what it is, some of the high priority issues on achalasia.